Hey everybody, and welcome back. We're going to be talking about peripheral nervous system disorders. I'm going to show you the insider information and secrets to fully understanding this, okay? So great, let's jump right in. So we've got R.N. Cliff Notes, helping students see through larger concepts, and Cliff Davis, Associate Dean of Nursing, and longtime advanced medical surgical nursing instructor. So jumping right in, and here we go. So on your papers, on your pads, in your phone, in memos, right? What's the NMJ? Go ahead and write that down. Go ahead and document that somewhere. You know what? Let me add this to this video, okay? In many instances, it's important that you actually write it down. We type a bit too much. How about that, right? Writing is psychomotor activity. Kinesthetic learning, you really should write it. Okay, that's NMJ, neuromuscular junction, by the way. This word is going to come into play a little bit later, and we're going to do a little word play with that, and we're going to replace that J with the letter G, and you'll see why here in just a moment. Okay, and moving on. So the first disorder we wanted to talk about, myasthenia gravis. And, right, there's a couple of things I want you to do with this. First of all, look at the power in that. I mean, how many times you read about a disease, right? And you look at it, it's like, oof, I know I read about that before, but I don't remember what it was about. Okay, this is the power of what I'm showing you right now. So we're taking the letters off of each one of the words, the M and the G, and making sure it sticks in your mind about what this is actually about. Okay? So what's going on? Myasthenia gravis. This G, remember just a moment ago, we said we we're going to do a little bit of wordplay, and we were going to replace the J from junction with the letter G, and this is what we were talking about. Myasthenia gravis is a problem where? At the muscle, what? Junction. Okay. Yeah, check that out. So not only is it MG is myasthenia gravis, we recognize that as the abbreviation, but we also understand that it's a problem at the muscle junction, even though it's a letter G. Okie dokie. Now, here's a little bit more. So we're going to add some special sauce to this thing. I want you to notice that the patient has a drooping eye, right? So here's the circle created by the eye, and what? The eye is also drooping. But what I want you to notice is this letter G, what? There's a circle around the eye, and what? Something drooping underneath, which would be the lower lid in your patient's eye. Myasthenia gravis, a problem at the muscle junction. And by the way, patients tend to suffer from what? Ptosis, right? We see that with the letter P in front of it, ptosis. Great. All right, now, you guessed it. You know it, man. Quiz time, right? So fill in the blanks. We've got 1, we've got 2, we've got 3, 4, and we've got a 5 over there. And, of course, in the Mr. Davis way, right? In my tradition, if you've been in my class, there's always a bonus question. Right? So name this space here. Both names of the space. So there'll be a 6A and B, by the way. Go for it. What is 1? What is 2? What's 3? What's 4? What's 5? And what is 6A and B? All right? And what's the answer? It is this. So this is the nerve terminal, right? Coming in the case of coming from your neuron or something like that, it'd be like an axon coming away from the cell body, but the nerve terminal, okay? And by the way, it's got little vesicles of acetylcholine. Acetylcholine's these little red dots. I want you to think about them being salt sprinkles, right? Okay, and let's get into that for a minute. Look at this like an upside down salt shaker. And it's got the little sprinkles coming out. And what are the sprinkles doing? Landing on the muscle. By the way, if there's not enough of those sprinkles landing on your patient's muscle, You ask them to flex their muscle, and the patient goes, oh, right? They can't do it. Why can't they do it? There isn't enough of the neurotransmitter, acetylcholine, being sprinkled on that muscle. That's what that action takes. Okay? So, we've got our acetylcholine, and unfortunately for our client that can't make the muscle, we've got an overactive acetylcholine esterase. Okay, now let's bring you into the know, just in case you don't. Okay, so let's flip this or bounce this off of fat. If we're talking about fat on your body, the other name for fat, we call it what? Lipids. And if it's the kind of enzyme that eats lipids, then we add the suffix ase to it. So if it eats whatever it eats, and then we add ase. Name what it eats, and we add ase. So in the case of fats, what? It would be lipids or lipase. Lipase would be the enzyme that eats fat. So enzymes name what they eat, okay? In the same sense, if this is acetylcholine, these little red dots, this guy's name is what? Acetylcholine what? Esterase. So it's eating the little red dots, and they're dying and winding up coming out of the back of it, and they've changed color, and they're in little pieces because he chomped it up. Okay, so what I did is I took the letter A, of course, and turned it to the side, made it massive, and I added little sharp teeth on the inside, if you can see that. Yeah, right. So anyway, so that guy's coming around like Pac-Man and eating up the acetylcholine. Now, what the acetylcholine were trying to do, they were trying to make it to these muscle receptors, these purple ones. And that's why you've got that there. ACHR. Acetylcholine, what? Receptors. That's what those purple ones are. And if the little red dot lands there, then once they land there, that energy gets, right, sent to the muscle, and the muscle contracts. If no acetylcholine makes it to a receptor, what happens? No energy. No energy is being sent down the nerve line there. Okay? Yeah. So muscles on this other side, as we see there, and this is where the acetylcholine receptors are. Now, by the way, we added, what is this space? And earlier we talked about this is a problem where? At the muscle junction, right? And we earlier mentioned what? The NMJ, nerve terminal, neuromuscular junction. Neuromuscular junction. Also known as B, 6B would be what? The synaptic cleft, the synapse. A cleft is like a space in between. And this is where the nerve synapse is, meeting up with your muscles, synaptic cleft. All right? Super, super. All right then. Let's hope I move this the right way. Okay. Yeah, good. All right, so MS this time. And unfortunately for these clients, that's what they are. N-A what? MS. Mess. Wow. These poor folks, they suffer from a lot of things. Oh, I mean, one thing is, right, at first, check this out. MS, what does that stand for? Myelin, which we're going to talk about that in a minute, and sheath. So this is the way I teach you, that this is a problem. Sure, it's muscular sclerosis, right? So muscular sclerosis is also a problem where? At the myelin sheath. So good, MS. So you see, you'll remember it when it's time. What are some of the things that happen to these poor people? Well, one thing is you have to remember it's impacting every part of their body. So some people suffer from diplopia. Diplopia, what's that? Double vision. Some people are incontinent of urine, incontinent of stool, right? Why? Because their nerves, the myelin sheaths that cover their nerves, that myelin sheath is damaged. So some of those things are mentioned in here. Sleep disorders, sensory problems, visions problems, like we talked about the diplopia. Cognitive changes, right? Yeah, So lots of motor problems, tingling, cerebellar spasms and ataxia, emotional changes. So they go through a lot. They're in a mess, literally, right? So unfortunate. But they manage. Okay. Now here, of course, I want you to label this. And we got 1, 2, and 3 this time. So what are those? 1, 2, and 3. Okay? And we said what? That this was a problem with the myelin sheath. And this is what a normal myelin sheath should look like. Right? And going through that myelin sheath is the axon. Then over here we see a version of a damaged one. For whatever reason, this person's immune system, things like that, is attacking the patient's myelin sheath and damaging those. And here, let's make it more plain. If you've ever tinkered with wires at all, right? And if you ever have exposed wire, and say you were putting that in a speaker or something like that, and wow, it's making that noise like that, it's not clear like it should be, same thing's happening here. You've got what? Damaged myelin, and some of the wire underneath is what? Exposed, right? So the electricity doesn't get sent down the wire like it should. Doesn't get sent down the axon like it should. By the way, here's another little bonus piece. In between these myelin sheaths, this is called a node. In between those rows. And nodal jumping, your body can engage in nodal jumping. When a signal needs to go down the axon quickly, it can jump from node to node, boom, just like that, and go much quicker. But nodal jumping is practically impossible when you have damaged myelin. So this one's always going to travel slower, right? So maybe in the past, a person with MS, they could run like everybody else. But now that their sheaths are damaged, they can't. They can't run fast like they used to. Because their body can't engage in nodal jumping. Yeah? Okay. So anyway, myelin sheath, axon, and damaged sheath. All right, good. Moving on. ALS. So this is amyotrophic lateral sclerosis. Also, I teach you to flip these letters and do something else with it. And we'll get into that in just a minute. But if we look at our gentleman here, right? Amyotrophic lateral sclerosis. Again, sounds like with MS was what? Multiple sclerosis? Sclerosis of what? The nerve endings, right? The axons. So, yeah. This is also known as Lou Gehrig's disease. For those that don't know Lou Gehrig, I advise you to check out his clip. He's got a couple of clips. One of them especially is a black and white clip where he's saying goodbye to people in a stadium full of baseball fans. And we have to think, this is back in the day when baseball was like everything. It was like one of the biggest, sports out there. So he's like the LeBron James of back in the day, And then he's telling people that he knows that he's going to die from this disease. So they named that disease after him, but when it's not being referred to as Lou Gehrig's, it's called ALS. All right? And now, this is the other way that I teach my students to remember ALS. That what? After this disease gets a hold of our patients, they lose control of their arms, they lose control of their legs, and they lose control of their speech. ALS, arms, legs, and speech loss. And unfortunately in their case, speech loss is significant. Why? What would be next? Potentially difficulty swallowing. After having difficulty swallowing, right? Well, anyway, there's a great tendency to choke on their food potentially. But then likely after difficulty speaking, swallowing, potentially breathing, difficulty breathing, and you tend to see them with breathing apparatuses and things like that, right? Ventilators. So arms, legs, speech. All righty. Now, Guillain-Barre syndrome. Guillain-Barre syndrome, or GBS. This is another one. This one can be really elusive. I mean, you read it weeks ago, and then, later on the test, it's like, oh my God, I remember reading about it, but I don't remember it now, okay? But now you will. Why? Because you're watching this video. Here we go. GBS, Guillain-Barre syndrome. Here's what I teach, right? This is gotten by a sickness or a shot. Okay, let that settle in. It's going to make sense here in just a minute. Okay, gotten by a sickness or a shot. GBS. Okay, here's what we're doing. And by the way, I want to make reference to the Mayo Clinic for this definition of GBS. The exact cause of Guillain-Barre syndrome isn't known. The disorder usually appears days or weeks after a respiratory or digestive tract infection. What did we just say? Gotten by a sickness, yeah? So days or weeks after a respiratory or digestive tract infection, rarely recent surgery or what? Immunization can trigger Guillain-Barre syndrome. And we just said gotten by a sickness or a shot. GBS. Yeah, okay. Okay. Now, by the way, here's some more of my, fancy artwork here, to a degree. Okay. So here's what we got happening. We've got a dog that we're going to name T, right? That's a great name for a dog, isn't it? Anyway, all right, so our dog T is attacking this guy who represents an axon. And what this does is sort of help you to interpret in your mind what's actually happening with GBS, okay? So we got a T cell doing what? Damaging an axon, biting into it. Okay, but here, let's bring you up to speed. Okay, after you get your vaccination, okay, and so the needle goes in near your nerves, and you had your vaccination. That vaccination is sitting deep near your nerves. Your T cells go and attack that new invading whatever it is. They don't understand what it is, but they start attacking in that area. And your T cells, as they're damaging, trying to cause damage to this, what looks to be a would-be invader. At some point, your T cells get a taste for your own nervous system, your own myelin off of your sheaths. And your T cells keep attacking, and actually move from this area and start attacking other nerves in your body. Now, right, here's where we want to illustrate something that's really going to help you out. So, like a dog, right, what happens? Even though this guy is probably a good guy in uniform, what's happened to the dog? The dog is like in a heightened state of attack, just like your T cells. And what? Not recognizing that the axon is what? Hey, this axon is one of our guys. So it doesn't see that. What is it doing? It's attacking. And by the way, over his arm, what does he have? A covering, a protective covering, doesn't he? And what's the dog doing? Biting into it. And any of these guys will tell you, if you ask them, that as much as that thing is designed to protect their arm, right, the sheath around their arm, those guys are like, I can still feel the dog like, I didn't feel his teeth, but ooh, it hurt, right? So they're training the dog, but that still hurts them, okay? So the dog's biting through the sheath and still causing pain to one of the good guys. And that's what's happening here, okay? So yeah, so GBS. All right, now, we're going to add a tidbit here because this is important for examinations. Because sometimes you take a test and you need to know which direction some of these things are moving in. Now, I want you to think about it. Earlier we said myasthenia gravis. What direction did that disease move in, right? What did it move? How did it move? It moved what? It moved by gravity, right? It descended on your client. Yeah, it took a hold of them in a descending fashion. Well, what I want you to realize about GBS, right? Let's go back to GBS, and believe it or not, we're gonna bounce this off of some hip hop artists. Who knew? Okay, here we go. GBS. So there's a hip hop artist that everybody on the planet knows named Drake, right? Who knew that we learned something from Drake about nursing? Check that out. Okay. So what's going on? GBS goes from the bottom. Goes from the bottom. So it's the opposite of myasthenia gravis. GBS, what? It drakes. It goes from the bottom and it ascends on your client. Yeah, that's how it takes a hold on them. So they lose control of their feet first and their legs, right? Then their arms, and then their head and neck, right? Yeah, goes from the bottom. What? GB, goes from the bottom. Yeah, all right. Then the other one that we said, because we said hip hop artists, let's do that again. Then this time, we're gonna bring it back to this one. And this guy, believe it or not, we're gonna add a little bit of Little John in there, right? Because what do we have happening here? What is the dog doing? Doesn't know how to turn down. Turn down for what? That's what's going on there. So we got our T cell, Little John. Okay. So anyway, a little fun with that stuff. The end, guys. Hey, continue to study smart. Thank you for tuning in. Thank you for your likes, and especially you subscribers. Go. All right? Thanks.